Hey guys, Nick Drossos,
And Dr. Laurent here.
and today we're going to be talking about.
Hair loss, which is alopecia.
So, I was just telling Dr. Laurent, I always thought alopecia was just for women, and because men normally we talk about hair loss, but we don't use that word. So, is there a reason?
No,
It's the
we
same
use
thing,
the
right?
most educated word, most.
Because men were like, normally I'm losing my hair,
I'm
hair
losing my
loss.
hair,
Yeah.
period. Women will tell you I have alopecia,
Yes.
but both are the same.
Okay.
It's called male pattern alopecia or female pattern alopecia.
Okay.
Okay, both of them have the same thing.
Okay.
So before starting, I will tell you guys, society always accept a better looking, younger looking face. That's why hair loss is a problem for most men in this world.
Well, I did my hair transplant,
Oh, tell me about that.
right? So, I did my hair transplant 8 months ago, and that's why we're going to do PRP
Yes.
later. And it like, I mean, it bothered me. I was always wearing a cap. Sometimes I would see myself on camera, certain angles. It didn't bother me to the point where I didn't want to go out, but it did make me feel like, I think I want to do something about it. And
So-
then I found that company in Greece, hair loss company, DHI, which was
Okay.
unbelievable. The experience was amazing. The service, the results are there. So I'm 8 months in,
Good.
and I see and I feel the difference.
Okay.
So there's definitely something there, as well as psychologically, my confidence.
Always. Always.
A lot more than what I expected. That I have to be honest, a lot more than I
Huh.
expected.
So people who are losing their hair might come to their professional or their doctors with low self-esteem, psychological issues, coming for other problems. But when you dig deep again, you will find the real problem why they come see you. It might be alopecia. I had a patient, a very young male in his 20s, coming, tell me, doctor, I want this and that pill. I was like, why do you want it? I'm losing my hair. I did the test, but he was not losing his hair. I'm like, well, you have a male pattern. It's normal to have your hair like that.
What do you mean male pattern?
Male pattern, I will explain that to you. So, but he was not losing his hair because women and men, we don't have the same hairline.
Oh yeah, it's true. Yeah, for sure.
Men is, more recessed in men. And that is something that will bring us to hair loss. Okay, so how we recognize hair loss? We will see hair loss usually in men, okay? We see it in women too. And we can have many, many causes, many different causes, hormonal, okay? Let's say men with long hair who pulls their hair back, traction, alopecia.
For real?
Yes.
I always thought that was like a myth or something. Like,
Yep. And also people who pull their hair and eats them, trichotillomania. That is something.
What do you call that?
Trichotillomania.
So, like people.
They pull it and they eat it,
What do you mean eat it?
swallow it.
Okay. Sorry, I never heard that.
Yes, that is
Okay.
that is psychiatric
Yeah,
issue
yeah, for sure.
that we can deal with.
Okay.
Okay. Also, some medications can do that too. Let's say when you have cancer,
Yeah.
chemotherapy can do that. It thins your hair out and it falls. So it's completely normal to have some hair loss at a point in time because your hair goes through a cycle. So that cycle, the telogen phase, the last phase, your hair will grow thinner and will fall at a point in time and it will grow back
So I have a
if you're
question.
young.
Yeah. So I have a question.
Yes.
Is it a process that every man will lose his hair?
Everyone on earth, every single mammal that has hair will lose them at a point in time because it's a phase you will shed. Let's use that word. You will shed your hair and it will grow back. Because everyone usually have, let's say, 10 to 15% of their hair ready to be ready to fall.
Yeah.
So you will see it. If you comb your hair, if you have longer hair, you will see the fall.
Is it true that wearing a cap could
Wearing a cap.
like wearing a base,
Yeah,
like
yeah.
wearing a cap. Does it have anything to do with hair loss?
If it does traction on on your hair, of course. If it's too tight, yes, it might do the same as wearing your hair back. Can do the same.
So, to go back to my question, because I want to try to understand this. As every man gets older, he will lose all his.
Not necessarily.
Okay.
If your father is more, let's say, we have many factors that comes into play. Let's say hormones, testosterone, TRT.
So wait, if I remember correct, the more testosterone you have,
More hair
loss.
you might lose.
Okay.
I say might lose
Might,
because
yeah.
we have other factors too.
Okay.
Let's say genetic factors. If your father, okay, if your grandpa was bald, you have more risk of being bald.
Like my dad was bald. Don't tell me I'm gonna be bald. I didn't do my hair transplant for nothing.
Oh, well, I won't say anything, but what we can do is to help your hair stay in the anagen phase for longer. So when we do PRP, when we do mesotherapy to your hair, what it does, it nourishes your hair follicle. So that hair follicle will give a bigger, thicker hair that will stay there for longer. But it's completely normal for your hair to fall.
And so what is? Let's look at like natural treatments. Is there natural treatments to prevent this?
Natural treatments. Well, if your hair will fall, it will fall. That's it, period. So if you want a natural treatment, you will have to accept to live with baldness. That's it, period.
But what if what
What
you
do you
decide
call
to eat?
natural treatment?
Like
I need
like
to make sure.
Any good question. Like I mean, like is there foods we can eat? Is there creams, topical creams we can put?
Well, it's what you call natural treatment. Okay. Those are not natural treatments.
Yeah.
Let's say we have minoxidils.
Yes.
Minoxidil is what we call Rogaine that we can use on our scalp that will help our hair stay for longer.
Does it work? Does it work?
Well, I never used it, so I can tell
Is
you.
there any? Is there?
I can prescribe it. I prescribe it. It works for some people, but let's say that you do only that. If it's early, well, it might work, but if it's late in your
like
process,
now, is it now for me to take it?
you could use it now since you
of the
have
hair
new hair follicles in there. So you could use it. Let's say you will put Rogaine. We will still do PRP. We will do what we have to do for you. Some people might use some pills too.
Okay.
Pills, minoxidil and pills.
Is there side effects to those things? Because I've heard
Of
some of
course,
them.
minoxidil is a heart medication that had a side effect for growing hair, so that's why they use it.
Okay.
That's the only reason. And there is finasteride too, that the Alopecia that everybody knows about. Everybody comes in my clinic asking for Alopecia. They don't know it's an anti-testosterone pill.
So that's one of the reasons why I don't want to take it. Because I don't want to, like, I'm going to have more hair, but lower my testosterone.
But
I want to keep my testosterone.
But we need to say it's dose dependent. With the dose that you take, the Alopecia might not have a lot of effect on your testosterone at 1 milligram. Okay. You might not have, a decreased libido, you not have erectile dysfunction. You might not have that at 1 milligram.
Okay.
So it's a medication that we use also to treat prostate cancer.
Oh,
Yes, hair loss is completely normal. So you usually see that people lose their hair on the coronal area and frontal area. You don't lose it in the back because you have more substance there, period.
So the reason why we don't is because
you don't lose it usually in the back. It stays for longer. You have more substance there. This is
more substance
exactly
means what? More hair, thicker hair?
More tissue.
Okay, that's
there.
what
This is directly on the bone. It's your skin with hair follicle.
Okay.
With the tendon and the bone.
Which is interesting because when they did my hair transplant, obviously they took it from here. They took like this thing and they checked my hairs and they picked it from here. So
yes, exactly. Then they put it in the front.
And they can still take more. Like I mean,
That's how it works.
And
That's the
is
process.
there a reason why you lose more here than here?
It's
That's
ask that to Mother Nature.
okay, so there's
I told
nothing.
you the only reason that I can explain is because you have more substance in the bag, okay,
Okay.
more tissue in the bag. That what makes sense to me. But genetic factors, we said, environmental factors, traction, infection might make you lose your hair. Yes, exactly. Mycotic infection. If you have what we call a tinea capitis, you might lose your hair. Well, you might have a patch, but you won't lose completely the hair. The hair will be thin, but when you treat that, the hair will grow back. So we have many factors that we need to identify. When you go see your doctor or nurse or whomever you see, that person will identify where you have the hair loss. One, will quantify your hair loss, will put you on a scale from 1 to 6 for a man to tell you at which stage you are. If you are to 6, it's an egg. That part completely as bold as this, So we can't do anything. We prefer to treat people from 2 to 4. That makes a difference, 1 is completely normal. So guys, we can treat this. It's treatable if you come early. Don't wait until you lose everything to come to me and ask me about PRP or mesotherapy or whatever it is.
So what? Sorry, I'm asking because what's early? Like, I mean,
Early.
is an age or is it when you start
It's
seeing?
not necessarily an age, okay? You can see my line is recessing, goes from the sides because it was here before. So I'm supposed to see my doctor to do something about this, okay? Do not wait until it gets to the middle to come to see me. That might be a bit close to be too late.
I think when I look back at the age of 35, I should have went and should have seen
Exactly.
somebody. Like, I mean, that's when I started losing
If you
my hair.
did PRP before, you might not even need that.
Wow.
Okay, let's say that you did PRP, but you might still lose your hair, and you will do it and still do PRP to go with it. Okay, because what people need to understand, if you do PRP, you have to maintain it. We have to mix it with something else. You don't just do PRP and it stays there. You do PRP and do something.
Okay.
Okay, let's say that you do minoxidil with it. You keep putting you still put your Wogaine on. I have no problem with that. If you are taking finasteride, you keep taking it. Okay, we are trying to help your hair follicle, not to lose that hair, for your hair to be thicker.
So technically, for me, who did my hair transplant, I should do, which we're doing PRP
Yes,
after,
exactly.
and
We
then I
can
should put-
keep your Wogaine on. Let's say that you have Wogaine at home. You put it.
Is there any any side effects to it? Because me, I'm very like I try to
What
keep
does
everything as.
Wogaine do? What does Wogaine do? Make your hair grow, right? Do not let it go to your frontal area. That's what they tell you not to do. Yes, if you want to grow a beard, just put it in your beard. That's what
it.
people do. That's it.
There's no side effects to it.
Well, side effects, skin sensitivity, yes. Some people have a sensitive skin, they might not use it. If you have a sensitivity reaction while putting a medication or a cream, you have to stop using it and see your professional. That's how it works. To make sure that you don't use it again and again and let that thing go further and it's not treatable.
What about like dandruff and stuff? Like, what does that have to do? Is
sorry,
that
what?
like dandruff and? Because I know I have seborrheitis.
Yes.
And I get dandruff, so like I could see sometimes my skin get red, and I have like little.
That's another issue that you can treat easily. We have shampoo that treats that. You can take a cream that treats it. That's very, very easy to treat.
But does that have anything to do with hair loss?
Well, let's say if you comb your hair too much, you will lose more hair, period.
What about washing your hair? I think we talked about it. Washing your hair.
Yes. If you wash your hair more, you will see more loss of hair because you will have 10 to 15% of your hair ready to fall. Wow. So if you comb them, they will come out. We need to make a difference between hair loss versus hair breakage.
Oh.
Complete difference. When you have an infection, the hair breaks at the bottom of it, but it's still there. So that's why when you treat it, it grows back. When you have, alopecia, like spot alopecia, if it's traumatic, it might grow back if you treat it. But let's say it's baldness, it will take more time to grow back, and we need to treat it first thing, early. Let's say when you have the recession, come see us. That's the moment to start. That's the moment you start your Rogaine. Don't wait until your head look like an egg. Don't wait until it look like an eggshell to put Rogaine on. We cannot go hair on an eggshell. We cannot do that.
That's a good point.
If we could, we would have hair on the eggs that we buy. So there is nothing we can do if it looks like this.
I have a last question because there's this idea, and at one point I was just shaving my head because I heard if you shave your head, the hair is going to come out thicker. Like, this is probably a myth?
It's not a myth, actually.
Oh, okay.
People need to understand, if the hair is shorter, it looks thicker. It looks thicker. But when it goes longer, it gives more time to the follicle to age, and the hair itself will go thinner. So let's say that you have a follicle itself that is aging. The follicle will give you thin hair even if you shave it. People need to understand that. It's important for you to understand if you have, alopecia, we need to treat it. We don't want you to shave it to shaving it is not accepting it. It's completely different. Okay? So if you want to have a bald head, good for you. So if you don't want it, if you want me to treat it for you, come see me. I will happily see you, and I will accompany you through that process.
That's awesome, guys. I hope you guys enjoyed this episode. Next week, we're going to be talking about PRP. We're going to be doing PRP over here.
Oh, yeah, of course.
My first session.
Yes. He won't get away. I will make sure
I'm not
that
crazy
we do
about
it.
needles, guys, but we're going to do it live, so make sure to check out next week's episode, guys.
See you, guys.